Good morning, everyone. Thank you so much for joining us this beautiful Thursday morning for our webinar workshop. We appreciate you spending just a small part of your day with us today. Glad each of you opened your eyes to see the sun. So my name is Brian Griffin, a marketing assistant here at Messer Financial Group. Many of you are already familiar with Messer Financial, but in case you don't know, we are an FMO located in beautiful Mint Hill, North Carolina. We did start with only 2 agents. We're now serving thousands of agents across 40 states, and we are still growing. So today, we're going to be learning about Oak Street Health. Oak Street is a primary care provider with a value-based care model. They've set themselves apart by not only providing great service, but also reaching out to lower income communities with humanitarian efforts. So today we do have Josh Nadeau, a regional partnership manager for North Carolina, and Scott Hanlon, a divisional market director with North Carolina, here to educate us on the advantages of Oak Street Health and how their model is a win-win for agents and our clients. So before we do get started, a few housekeeping rules. We're going to hold all questions until the end of this presentation. If you do have questions, just type in the box on the right-hand side of your screen, and we'll get to as many as we can at the conclusion of the presentation. So now, without any further delay, Mr. Josh Nadeau and Scott Hanlon.
Thank you, guys. This is Scott. Josh, please feel free to jump in if I'm missing any salient points that need to be made. Thank you, Brian. I appreciate the introductions. We are a primary care provider, but to kind of identify us just as that would be almost an insult to what we do. Oak Street Health is serving close to 100,000 patients at this point, less than 7 years out. And what's unique about it is it's a value-based model. For North Carolina, I know there are some other value-based models that exist out there. IORA, Partners in Primary Care, for instance, are 2 examples. Most of the markets we're in, we're kind of out there by ourselves, where there's this value-based concept doesn't really exist until we enter those markets. I think the agents that are already working with us in the last 6 months for the North Carolina market will tell you that what we're doing is distinct, very unique compared to other value-based models that exist throughout the United States. And as I get into this presentation and some of the data, I think that will bear out the fruit of what we're doing and how well and how delighted our patients are that do come to us. I'll start off by saying Oak Street Health, one of the big unique factors and why you're on this call is that we work with agents. We work with agents very, very intimately. A lot of the agents that work with us from day one, such as Indianapolis, where we started about 5 years ago, they almost feel like they're part of Oak Street and that they help build that market for us. And then I'll explain that a little later why that is, but it really is a unique situation in how we work with agents, looking for agents that really have a heart for the population and the demographics we serve. Some of the big differentiators at a high level, Cliff Notes version, it's about how much time we're spending with our patients. It's about how easy or how we remove hurdles for our patient population so that they have total access to us. That's a big factor on why we see low STAR scores in certain populations and certain states even. It's just the access to care is horrible. It's even worse when you start adjusting for income levels. The lower you go on the income levels, the worse the access is for these folks, which is a big reason why Oak Street is needed. The third thing is that the personalized care is really way beyond just a doctor to a patient relationship. There are so many other things that I'll get into today that we do for our patients that not only helps the patient improves their health, but it's also, as you'll see, it's a great benefit to the agent as well for the clients that they serve, especially in the neighborhoods that Oak Street exists. So just some quick data, and I'm going to fly through these slides, certainly get into the meat of it. At the end will be really how do you plug in as an agent? What does Oak Street mean for you and your clients? But so I'm going to breeze through the first probably 2/3 of these slides. we create access where it's needed the most. If you look at the populations that we serve across 57 centers from Chicago to Philadelphia down to North Carolina, we are looking at a situation where over 50% of all of our Medicare folks or all of Americans are underserved in primary care. That's a huge number. 67.5% of Americans are underserved in the mental health side of things, which frankly doesn't surprise me because I've worked in the neuroscience and mental health arena for about 10 years of my career on the pharmaceutical side. 47, this is interesting, 47% of Hispanic men and 31% of Black men, as well as 28% of all men, do not have a primary care physician. So you guys out there, you know I'm talking to you, find yourself a primary care doctor. And overall, I think what we're seeing is that 32% of Hispanic women and 17% of all women also do not have a primary care doctor. One of the things that we really strive for, and I'm going to stop for a second and talk about a really important point that I like to make with those that are unfamiliar with Oak Street. We are when I say we're value-based, it also means that we're at an at-risk model. What does that really mean? It means if our patients are not getting healthier, if they're going down in their health scores, we're actually losing money. We financially are at risk for our patients, and those are the types of contracts we have with the carriers that you're appointed to. The Humana's, United Healthcares of the world, WellCare in North Carolina as well, and Cigna. Advantage Health Team is also another carrier that we have under contract in North Carolina. But we do at-risk contracts, which essentially means we're taking the risk from the carriers, and they love that because not only are we taking that risk from them, we're also taking that 10% of their membership that's costing them probably 70% of their budget of their premiums that they're having to spend out. So it's a great relationship if you're a carrier, because you're getting a company, a group of providers that are going to intensely manage the very sickest folks that are underneath your umbrella if you're one of those carriers. That comes from really having an accountable care team approach. Things like, if one of our patients are in the hospital, we know about it. By 10 o'clock in the morning, we're on the phone with the carrier, and they're letting us know who was admitted last night so that we can immediately get to the hospital, talk to the care team at the hospital, begin to prepare for their discharge, and even show up at their home that day that they're being released from the hospital so that we can do medicine reconciliations so that they're not readmitted back into the hospital. And that's why we're seeing things like versus, the general population that we serve across the country, we've been able to reduce readmissions by 26%, which is a huge number and really is bending the cost curve. I think when you think about healthcare across the United States, those that have been intimately involved with it, and even from a provider standpoint, will tell you it's really kind of broken. And it's not necessarily blame goes to one place. It can be spread around. And I think one of the biggest factors of this is just sort of the philosophical approach to healthcare from the patient standpoint, where it's really episodic treatment. They wait till something's wrong before they go for treatment, right? I'm guilty of that. I think we all have been. Rather than kind of making sure that we're having an annual wellness review, again, to you guys out there, are you having an annual physical? Let's not wait till we're 7 years old and then there's a lot of things going wrong and things are too far downhill. So the episodic treatment is a real factor on why we have huge healthcare costs year in and year out, and why folks could be healthier if we had a better approach. And that's what Oak Street's bringing to the table, is a focus on a comprehensive continuous care model that, frankly, as you'll see some of the data, it's working quite well. The big differentiators, if I were an agent out there selling, this is the information I'd want to know about Oak Street and I'd want to talk to my clients about. The average patient right now in the communities we serve, they before we come into these markets, they're generally getting somewhere around 4 or 5 minutes with their physician. And that time with the physician, by the way, is hurried. A lot of these doctors that are in the communities we serve have huge panels. They may have anywhere from 2,000 to 4,000 patients on their panels. Oak Street's providers, we keep those folks between 500 and 700 patients on those panels so that we can deliver the promise and carry out our mission for the folks that we serve. And again, remembering that we're serving the sickest folks in North Carolina, we really need to spend a lot of time with them. So the average amount of time we're spending with these folks is over 20 minutes. And the very first 2 visits we have with them is around 40 minutes each visit, so that they get to know us and we can really allow them to ask all the questions they need to ask and to give us a really robust, full history of what's going on in their health, on the health side of things. Not only that, the doctors do not carry a laptop. They do not walk into the patient room with a laptop. We have full-time employees called scribes. They're generally folks that are going to go to medical school over the next year or two. And so they're getting really good training as well, but they do all the documentation for the doctor so that he or she can look at that patient eyeball to eyeball and really connect with them and make sure that no stone is left unturned. That's really, really one of the keystones of why we're having a lot of success. And because our panels are small for each provider, we're able to carry out the promise that if your client needs to see us today, or they need to get in tomorrow, they can do that. That experience for most of these folks before we come does not exist. They're having to, this is why you see them using the ERs, folks, on the lower income side of things, because they can't get into doctors. It takes them 10, 12 weeks sometimes to get into the doctors that are available in that 5-mile radius of where they live. The other thing that we bring to the table is a full-time person at every center called a patient relationship manager. That is a service for the insurance agent as well, because we're here to answer any Medicare questions that these clients of yours may have. And I think it's fair to say, I've been doing this for heading into my 4th year. It's fair to say that on the lower income side, in the neighborhoods that we're serving, they tend to be a little higher maintenance. And maybe that's because they're sicker. Maybe it's because their healthcare literacy isn't as high as maybe the folks out in the suburbs. For whatever reason it is, they do tend to call their agents a lot more, have a lot more issues that need to be dealt with, which can burn up a lot of hours. I remember last year we had someone in Indianapolis, a patient who had lost their eligibility for Medicaid unexpectedly. It was at the pharmacy and they were trying to charge him $100. Truth of the matter is, he still qualified for Medicaid, but he didn't know where to go. He came to his patient relationship manager in our Irvington Center in Indianapolis. We literally spent 3 hours being disconnected on and off with the state of Indiana's Medicaid, only to find out eventually that he was accidentally knocked off. No one to this day knows why. But you guys have all seen these kind of things. It's the bureaucracy of our governments at work. But we were able to get him back onto his Medicaid at that moment, and then he was able to get his prescription. Now, guess who would have been spending that 3 hours? It probably would have been his agent had Oak Street not been around, had he not been one of our clients. So that's just a good example of the things that we do. One of the biggest reason agents talk about Oak Street when they're enrolling new clients, or even talking to their existing clients that really live in that 5 to 10 mile radius of our centers, is the transportation. Now, I realize that when you're signing folks up, the plans you're putting them on, most of them have transportation, particularly the dual eligibles. They generally do, but if we're all being honest with ourselves and you talk to your clients, it isn't always that reliable. I can tell you nightmare stories, and I'm sure you can share some too, where folks have finally gotten the transportation arranged. It shows up late and they get them to the center. And after their appointment's over, that transportation is nowhere to be found. And if you're 80 years old, that's a time for panic. So we have decided with our care model and the way it works, the fact that we're at risk, we don't want this to be a reason for them not to go to the doctor. If they have family members, sometimes they don't want to be a burden on them and ask them to take them to the doctor. Let's just remove the hurdle altogether. So we provide our own vans, our own nice shiny green vans that you'll see running around Charlotte and Greensburg right now. They pick them up from the door, and they're wheelchair accessible. And the folks that are picking them up have the same mission we have. They're heartfelt, they're warm, They're treating these folks as if they're their own parents, and that's part of that experience, that red carpet concierge service that we want to provide. Another big thing, and for me, one of my biggest pet peeves, whether it's healthcare or insurance or credit cards or whatever, I'm so burned out on the service side of all these businesses that you and I have to interact with when we need help. They put us on phone trees, the automated voice telling you, hey, say a word and we'll connect you here. And you end up losing your mind. At least I do. Maybe I'm not a patient person, but what we try to do is also eliminate that and create a 24/7 patient support line where they're getting a live voice. We don't have voicemail. We don't have phone trees. Christmas night at midnight or 1 a.m, they're calling us and we're scheduling their appointment for the next day. With the vans, the transportation also showing up. So it could be an 8:30 appointment and we're picking them up at 7:45 in the morning, even though they called us at midnight the night before. So that's really, really incredible service. And I think you'll see with our customer satisfaction scores that these kind of things really equate to really, really good satisfaction. And then one of the things, once we're back to normal and the virus is not keeping us all sequestered, I hope if you haven't been into an Oak Street, you'll come and visit. The community activities that we do every day, we've got these huge community rooms that with every build out we do, we want to make sure we have those. I'll say this, it is a healthcare related item. It's an investment in their health by providing this much square footage for them to be able to come in, watch movies, play bingo, get their hair done, learn how to use a computer, learn how to use their new smartphone they've gotten, sign up for Facebook for the first time. There's all these, speed dating is one, believe it or not. I like to mention that because it always cracks me up a little bit that is such a hot item for the seniors, but they love the speed dating sessions we do as well because they're lonely. But it's also the isolationism alone. When I say it's a health related item, it's an 80% increase in mortality when these folks are staying in their apartments, flipping channels every day. We got to get them out of their houses. And this is an investment. These are real dollars we're spending. It's an investment in their health. So jumping to the next slide, let's see. There we go. Just satisfaction. This is a really important slide, and I won't spend a lot of time on it, but Net Promoter Scores, for those that are not kind of marketing gurus, is really a customer satisfaction metric, and it's based on customer surveys. If you look at how the range works, it's -100 to a positive 100%. Most primary care doctors in North Carolina, the average score is a 3%. That may sound horrible, and it's not great. I'll be honest with you, it's not great. But it's not in the negatives, which it could be. There's some industries that fall into that. The best brands that you and I work with that every day in our lives are things like Costco, Netflix, Amazon, and even Uber. Their scores are somewhere in the 40% range to 80% range. Oak Street's Net Promoter Score is 92%. That blows anybody away. And I think for those agents that have sent clients to us, they realize how true this is because they're also getting referrals from some of these clients because they're so delighted with what we're doing. I'll stop for a second and tell you about how we delight our customers, our clients. I've got countless stories and they're emotional, but one of the biggest things that I hear from new patients, especially when we come into a new market, is one, they can't believe that these kind of facilities and this kind of service is for them. We had one gentleman in Greensboro that walked into the center for his first appointment. He stood in the entryway, looked left, looked right, turned around and walked back outside to the parking lot. We chased him down. We said, sir, can we help you? And his comment was, I think I'm in the wrong place. This can't be for me. And that is pretty emotional to me that he's used to not having good health care, folks. What they think is good health care is actually not good health care. And a lot of them will tell you they love their doctor, but they're not even seeing those doctors. They're not getting the type of service that we can provide. So I tell you that because if you're talking to clients in enrollment, I would ask a few more questions, such as the transportation, how much time are you getting with your doctor, et cetera. The other thing that patients commonly will tell us is this is the first time that my doctor has listened to me. Now, for you and I, that may not sound like a big deal, but if you're 75 years old and you've got diabetes, congestive heart failure, and maybe the kidneys are starting to go, that's a big deal. They need to be listened to. They need someone that they know cares and connects with them. That's what I hear time and time again. It's the first time a doctor's actually listening to me. So 92% net promoter score should blow everybody away. Let's talk about data. We've been able to reduce hospitalizations, again, in the sickest folks in North Carolina, Indiana, Illinois, Pennsylvania, Rhode Island, Texas is coming on soon. I mean, we've been able to reduce hospitalizations by 45% in the sickest folks in any one of those markets. That's an incredible number. And it's an incredible, when you think about healthcare and bending the cost curve, that's just an incredible data point. We've decreased ER visits by 48%. We have all but eliminated amputations due to diabetes. It's 98% reduction in amputations. I'd like to talk about that for a second. Why is that? How can we reduce, almost eliminate amputations due to diabetes? And by the way, our population is wrought with a high percentage of diabetes in the areas and the neighborhoods we're serving. How does that happen? It's because we're listening to them and they're getting all the time they need. We're not walking away from them and telling them, hey, you've already talked about 3 issues. Let's make another appointment. I want to hear, our docs want to hear about that 4th issue, which might be that sore on the foot, that if it's not attended to right now, 6 months from now, 12 months from now, an amputation could be happening. So we've got to hear, each time they're with us, we want to know everything that's going on. And that's how you produce that kind of data where it's 98% reduction. It's 73% reduction in open heart surgery. That's another big one. But on and on and on I can go with the data. Ultimately, for the carriers, what they love about Oak Street is that for patients that we have for 12 months and beyond, we're a 5-star primary care provider. There's nothing like that. I mean, the last time I heard about 5-star was 15 years ago, working with Kaiser Permanente out in California, where they have really tight control over their patient population. That's the only other time I've heard of 5-star. Oak Street is producing 5-star. What does that mean for you and for the carriers? It means for every half point that a carrier increases their star scores, for that market, CMS is allowing them around another $8 million to invest in their benefits for the next year. That means your clients, our patients, are getting even better benefits. It also makes that carrier more competitive versus the other carriers. So star ratings are a hot thing, a really important thing for the carriers. But to me, it comes down to that we're really taking excellent care of your clients. In terms of where we're growing, I won't talk about all the other markets. If you're looking at the screen, you can see that we've had tremendous growth since 2014. We're estimated to grow somewhere around 20 to 25% every year, really for the next 5 to 10 years. It's just, it's working so well, and we're really getting into markets where the need is great. There's a really tremendous unmet need. In North Carolina, our goals are really to be somewhere between 15 and 20 centers over the next 8 to 10 years. For those that aren't aware, we do have one on the East Charlotte side of town, which is off of Harrisburg and Albemarle Road. And then also off Freedom Drive on the west side of Charlotte. Those 2 centers are perfectly located. They're where the greatest need is. The agents that are working with us already will tell you that. And the growth has been, I mean, this has been one of the best launches we've ever had across Oak Street as the North Carolina market. The Greensboro is off Summit Avenue. For those that are, I think it's 1007 Summit Avenue. But I'm getting old, so I may have messed that address up, but I think that's what it is. The expansion plans are to also open up High Point. In fact, that center is ready to go, but we're not going to open it until things are back to normal. You just can't have a good launch when no one's coming out of their homes, of course. And then Winston-Salem will also open this year, later into the fall. We're looking at Durham, a couple locations there this year as well. Again, probably into the fall range, maybe even late fall is my guess. But everything is unpredictable right now, guys, as we kind of see where each state's going and how fast things are going to open back up. Some of this is just unpredictable. So I'm giving you my best guess right now. The bottom line is North Carolina is a critical state for us, and we're going to continue to grow, and we'd like to grow with you guys. You think about what's in it for the agent. Well, if I'm an agent, the way I think about things, if I'm signing up a lot of folks and I'm trying to grow from January through December, so the lock-in period, I'm looking for those SEPs, right? And those are going to probably fall, a lot of them, most of them, into the neighborhoods that Oak Street serves. A lot of duals, a lot of LIS. Those are the folks that we grow with agents a lot from January through September. But one of the key attributes of that is, that if your new client needs a doctor, we're always accepting new patients. So you don't have to spend a lot of time trying to find a new doctor for them. We can take care of them. We have tons of doctors, tons of providers. We're always scaling up. So if you go into one of the new centers in North Carolina, you'll see that half the center is still brand new and not being used. That's in preparation for the fast growth. We see somewhere around 100 for each center, somewhere around 100 new patients every month. Our outreach teams are meeting somewhere between 400 and 500 new people every month, which can lead to opportunity for agent partners as well, especially if they're on plans that we do not take, or they're not on a plan at all, which we run into a lot in these neighborhoods. We want to get them to the agents so that they can be put on a managed care plan, and we can improve their benefits, as well as expand the ability to treat them from a continuous care model. It's really hard for us to do that if they're state fee for service. So that's that. One of the biggest reasons, again, if I'm an agent with 500 clients, 400 clients, and even 100 or 150 of those fall into the sort of the demographic in the neighborhoods we serve, what I hear continually is it's tough to hold on to these folks. They're not like out in the suburbs where they stay on their plan. There's a lot of dropping of plans. There's many reasons why it happens. They're maybe being met by another agent at a food pantry. It can be silly things like they ordered their OTCs for the first time and they had not shown up. And you ask them, well, when did you order them? Well, 4 days ago. Okay, well, it's going to take a couple of weeks, Mrs. Smith. It's frustrating sometimes for the reasons why they drop plans. But if you're working with Oak Street and they're patients of ours, you've got a support system in place. There's a very high level of service that we're providing for these folks. We're talking to them at least every 3 weeks. A lot of these folks, over 50% of our population, are actually coming to see us on a monthly basis. They're coming and using our community room for activities. So we're staying engaged with them. The retention rate is over 90% for our patient population. Again, I would ask you to think about your own, if you've signed up a lot of duals, a lot of folks in the lower income side of things, I would ask you to think about your retention rate on those. The agents I talk to are telling me, hey, I'm losing anywhere from 20 to 40, many times as many as 50% of these clients over a 12-month period. If I can bring you a 90% retention rate because we're delighting them and we're caring for them and giving them the best health care, I think we'd all agree that's a real advantage for you and your book of business. We also are trying to make referrals as easy as possible for you, and I'll get to that in a second. The patient relationship manager is your asset. That is somebody that really, a full-time employee who's doing resource reviews. They need help with LIS applications, applying for Medicaid. We're doing all of that. And that's a way that we can help you if you don't have time to deal with these things. Another big one I talked about earlier is just the billing and the pharmaceutical side, support the prescription side. To have someone in your back pocket that can help you serve these clients is tremendous. So if they get a bill, and I think the sad part is that a lot of these folks, if they get a bill they shouldn't have gotten or they don't understand, they literally stay up all night worrying about it. And so now they know they've got somebody they can call directly with our PRMs, our patient relationship managers, And we take that from them, and we're the ones dealing with the 800 number and escalating these things so that it's not going to be a worry for this person. It's a big relief for them. If there's issues with their plans, we're going to escalate those things. We're going to deal with the service side of it. We're doing things like the very first time they come in and you put them on a new plan, we're going through their new benefits with them to make sure they know what's on there. When they come in for their monthly appointments, we're signing them up for their OTCs, making sure they're aware that they should be using their gym memberships, anything and everything that's a part of those plans. We want them to enjoy those things. And we all know, I mean, you look at like some of the gym memberships, a lot of these folks, I mean, if you talk to the carriers, it's like 3 to 5% of the population are actually taking advantage of these things. I don't want them to lose that. I don't want them to drop those benefits because they're not being used. But for us, it's also a retention strategy. We know if they're using their benefits, they're less likely to drop their plan. We do things like on our retention side, besides checking in with them and giving them a welcome kit initially, we do personalized follow-up calls through our call center and through our PRMs. We're anticipating any needs they might have with prescriptions. And if they need help, for instance, a lot of doctors' offices, their experience has been that they'll go in there and the doc will say, hey, I need you to go to gastroenterologist. Here's a couple of names and a couple of phone numbers, or a neurologist, or whatever specialist it is. We handhold them on this. We want to help them set those appointments up because we're at risk. We want to make sure they make those appointments. If they don't go to those, the doctors they've been going to probably won't even know for 6 months that they never made the appointment. So we want to make sure that that happens. And yet the other thing we do is a 90-day post checkup with every one of our clients. Again, that's a service to you as well. Checking in with them in about 90 days is when they start to think about dropping plans. So we want to get ahead of this and make sure that we remediate any issues they might have at that point.
Scott, I just want to add one piece to that, just regarding the retention and kind of the things we do. We have a new initiative that we're rolling out here, and we're kind of just starting to testing it, but we're rolling out to more patients. We contracted with Centauri, and what they're doing with our patients on managed care is they are doing outreach calls to our patients on our roster that are on managed care, and they're inquiring about their Medicaid eligibility. So they'll discuss things with them like extra help and how it can get that Part B premium back in their pockets. And they will help them with the applications. A lot of things that you as agents are doing for your clients. You know, we know that you take that extra step to go above and beyond for your clients and help with things like Medicaid and extra help and things like that. So we have people doing that for our patients, making sure they get screened for Medicaid eligibility, and also making sure that they don't fall off when they get those eligibility reviews and things like that. And you know, of course, keeping them on those plans helps the retention in the managed care plan as well. So it's just another resource that I wanted to put out there that's kind of exterior to Oak Street Health, but a contract partner we have to really help some of the roles that the agents are doing. And just to echo Scott's point, that we help support the agent initiative.
Thank you, Josh. That's well said. Thank you. And that's one of the keys too, as you'll find with Oak Street. Nobody's perfect. We're always striving to improve. We continue to see our health scores go up and our customer service. That's one of the things that when I started 4 years ago, we didn't have this 24/7 call center. We realized it was an issue and we wanted it to be really personal. So we've invested money in 2 call centers. One of them's actually in Charlotte. And if you, not that you want to go visit a call center, but it's huge, and it's really helping us not just in North Carolina, but in the other new markets that will be opening with Texas and New York, for instance. What do we really look for with agents? I want to start by saying this, and I've told Jeff this as well, Jeff Street. We're not looking for every agent to work with us. That's just would be foolish for us to say that. And Josh is my guy for North Carolina. He's really here to serve you. What we're looking for are agents that really have a heart for the demographic we're serving, that want to work in and around these neighborhoods. They're willing to develop their own marketing plan along with Messer to generate their leads in and around these zip codes, knowing that we're going to provide a high quality of service for these folks and that we're going to be able to retain them. It starts there. And so you've got to have the heart for these folks, and you've got to have sort of a hungriness that you want to grow. year round. It's not, if you're an AEP only agent and maybe you're selling life insurance and annuities during the lock-in period, that's cool. I love it. I'm happy for you, but I don't know that you'll be happy working with Oak Street because we do have growth goals. We want to work with agents that want to grow as well. And if you are built that way, we can work in our partnership with Messer to make that happen. So it starts there. The agents that really understand how important retention is love us. Those that realize that their phone is blowing up when they're not sending them to Oak Street because of the service side, they love us for that reason. But really, I would ask, there's newer agents probably on the line. If you haven't worked the duals a lot, we're interested in talking to you. We can test some things out along with Messer and see if we can help you grow and see if this is an area that you really want to be in. I know a lot of agents that are doing really, really well because of their partnership with Oak Street. But again, I want to emphasize it's not necessarily for every agent out there. It's really for the 5% of agents that see this as a good opportunity and they want to give back to these communities. Let's skip over this. So how do you plug in? If you've got clients right now, there's obviously a lot going on. I can tell you that we're checking in with all of our current patients in North Carolina and across all of Oak Street over the past 6 weeks. We're doing weekly calls and checking into the most vulnerable folks. We've got agents even sending us names of clients that are not our clients right now because they know they're vulnerable and they need someone to be making a weekly call to them. Maybe they're isolated because they don't have family members that are supporting them. Maybe they're going without food. Those are things that Oak Street can help with. When I was saying earlier that we're far more than a primary care doctor's office, this is the kind of stuff I'm talking about. We're delivering meals weekly or care packages of food via our partnerships with the food banks and even with the insurance carriers, figuring out ways that we can get food to the most vulnerable. We had someone literally over the last 2 weeks when we were doing these check-ins, we always ask them, how are they doing on food? And the lady said, well, I'm down to this was in North Carolina, by the way, I'm down to my last can of food for my daughter and I. So this is a dire situation, folks. I don't mean to be hyperbolic, but it really is for many of these folks that we serve. We were able to get food to them that day, deliver some food, and we're monitoring that situation. That's a lot different than what your primary care office is probably doing right now. But if you've got clients that you want to refer to Oak Street, I'm trying to make this as simple and as easy as I possibly can. You can obviously, work through Josh if you have folks that you want to get to Oak Street and even set up a telemed appointment right now. We can do that. Or they need food support, they need a social worker, they may need toiletries, toothpaste, and things of that nature. We can help. But you can go through Josh, or to make it even simpler for you, you can use either our agent support line, which is 844-496-8741. You can email that person's information to us on our agent updates at oakstreethealth.com. Or what I prefer is using our Maybot, which is a text bot. For those familiar with what bots are, it's sort of an automated service that is available to all agents. If you have your cell phones, I'd love for you to pull them out right now. And I'd love for you to text the phone number that's on this slide, which is 312-626-8300. Again, it's 312-626-8300. Text that number with hi. If you do that right now, it's going to sign you up for what we call May, M-A-E. It's the name that we've given this text bot. And what she will do for you is be a resource. So if you have a person who's in need of help right now, you can literally type in referral, and it's going to immediately send you a link back so that you hit that link, type in the 7 boxes that are there, and our call center will immediately get to them and find out what their needs are. Some of them need telemed appointments. There are neighborhoods that we serve in Charlotte and Greensboro where these folks, even though they have a primary care doctor right now, he or she may not have telemed capabilities. I know that's true. We're seeing it all across the markets we're in. A side note or sidebar to this, we know that there are many primary care offices right now that are shut down. They are volume based, and they basically, there's a lot of them that are in jeopardy because there's no income coming in whatsoever for them because they're not set up like Oak Street is in a value-based, risk-based contracting situation. We can serve these folks. It can be a temporary solution for them right now. So let's say, Mrs. Johnson right now has a doctor she loves. He or she does not have these capabilities, but she needs care, and you're talking to her. We can deal with them, and they can always go back to that doctor once we're through this pandemic. And I'm not suggesting that you make this wild swing of trying to convert everybody over to our telemed, but you may run, as you're checking in with your clients, and we're asking that you do that if you haven't already. If they do need this, we can provide it for them, and we can also get them food and other needs that they might have. We've even had to, I didn't say this earlier, but part of our staff is we have behavioral health specialists on staff, and we also have social workers full-time on staff as well. If they need those kind of services, they need clothing, shelter support, anything like that, you can connect us to them through this Maybot, or by calling the 800 number, or directly going to Josh, and we can help take care of them. That is really the biggest reason today we're on this call, is it's a humanitarian call. I want to let you know we're here for you, we're here for your clients, and we're here to serve them whether they're our clients or not. So hopefully this all makes sense. I hope you will give May a try if you didn't do it over the last 5 minutes. Please go back and text that number so that you're signed up. You'll also get one of the big things I like about it is when let's look at AEP, where you guys are really rushed and you're seeing a lot of people every day. You've got a few that you run into that would be a good fit for Oak Street, and they're interested. But you don't want to look up provider IDs for Oak Street for, say, United Healthcare or Humana or Cigna. You literally, if you're signed up for this, can enter, say, Greensboro, provider ID, United Healthcare. And you text just that information, it's going to text you back the provider ID that you need to fill in for that enrollment. So those are the kind of things we're trying to do to make it simple for you. And then the last slide before we get to questions is more of a summary of things that we can do for you. There is a letter template that has talking points if you want to use it to check in with your clients. You can email it to them, but it just talks about you being able to connect them to telemed or any other resources that they may need right now, especially those who are in that 5 to 10 mile radius of our centers. We want to help those folks, so you can use that. We also have on this slide a link that you can download patient brochures, so that if you wanted to email those or print them off and send them to clients, if you're dropping information off to their mailbox, you can include that. So that's there as well. I would save this slide deck just so you have it available, especially this last slide. You can hit the link on the third big bullet point to go to our agent portal, which is a nice way to just stay updated on what Oak Street's doing. I will tell you that over 6 weeks ago, we converted all of our patients. 93% of them were seen by telemed or video chat. Our population, a lot of them don't have internet access, or they don't want to use, they may not have a smartphone, right? And they may not have a family member that can get them online. So a fair amount of these are purely done by the telephone with our doctors. And 93% of all the appointments are being done this way. About 35% of them, of that 93% are being done by video chat because they have access to that. What's interesting is that our net promoter scores are still between 88 and 90%, which means even though it's being done over the telephone, these folks are highly satisfied with the service they're getting. We're able to write prescriptions for them We're able to get them any help they need on the diagnostic side. If they need, x-rays, MRIs, we can still order those things for them. But what we're trying to do is just reduce their exposure to the virus, obviously. And frankly, the comments we're getting is they feel completely blessed that we're able to do it this way, because they're scared to go out of their homes and they don't want to be exposed to the virus unnecessarily, just because, maybe their knees are hurting and they need to talk to a doctor about something for pain or things of that nature. You don't want to take the chance of getting COVID for things that are unrelated. So that's there for you. Definitely want to say to you that if you've got clients that need that are not our clients right now, we can still help those as well. And just keep in mind the pathways for referring folks via the Maybot, and also going directly to Josh or even to myself if I can help you. That's the summary, and I think we're open to questions at this point.
I tell you what, Scott, I am completely blown away. The information that you just shared with us is, like you said, it is so much more than Oak Street is so much more than just a primary care. The information that you just went through is impressive. I appreciate you going through it and being so thorough. And I know that our agents are going to see the benefits of what you just presented. Okay, so we have a few questions here. The first one is, does Oak Street have a separate model for under 65?
Boy, that's a great question to start off with. I wish we did. We're basically not even 7 years old yet, but we're blowing it out of the water. I mean, like I said, 100,000 patients at this point. The model works really well in the Medicare population, just the way it's set up, and the way that CMS is willing to, the way that they're willing to compensate if you're doing a risk-based model. The folks that are the sickest, you actually get a higher per member per month or per member per year compensate or reimbursement from CMS, because they know that it costs more to take care of these folks. In the under 65, I hate to say this, and I'm not a political guy, but I think the only way we're going to be able to make that work is if there was like a Medicare for all model that comes down the road. So it just so happens that this is like the sweet spot. This is the wheelhouse to make this model really sing, is in the Medicare population.
Right. As you were going through it, the only, what kept going through my mind is really just putting the care back into healthcare.
Yeah.
I don't know if I've ever seen this level up close. And I mean, that's why it's so impressive. That's probably where that question came from also.
Yeah, the slogan we use, Ryan, is rebuilding healthcare the way it should be. I've been in healthcare. I should have said this up front. I've been in healthcare right out of college. I've been with Johnson & Johnson, Eli Lilly. My last stint before coming to Oak Street was at a place called Indiana University Health here in Indiana, where I live. It's 23 hospitals strong, huge healthcare system. You all know about those in North Carolina as well. They're huge, gigantic ships that have a hard time turning. And they like we talked about wanting to do what Oak Street's doing when I was on the executive committee at IU Health. We couldn't do it. We talked about it with population health, raising the, all ships rise. We just could not do it, man. It's hard to get a community of physicians to change how they practice for the last 40 years. By starting it from scratch and building this model the way we wanted it, that's why we're able to do this.
Awesome. And LaSanta, she actually just put in a comment. She said she's referred customers to Oak Street, and they are blown away by the care they receive. Most of them keep asking if this is legitimate, if it's real.
I love her.
Yes. So, that's awesome that you're getting that type of feedback. And we'll just do a couple more questions here. The next one says, as Oak Street grows, how can you continue the amount of focused care within each community?
It's simple. you keep doing the same things. It's making sure that your providers, you keep up on your hiring of providers, which, by the way, many of them that come to us, they come to us because they are so burned out and disenfranchised with the healthcare system that when they get wind of what we're doing, this is why they went to medical school. So they are enthusiastic. Their hearts are pouring out for these folks. They love on them. That's why it works, is you keep the panels down to 500 to 600 for these doctors, and you can always keep your promise that we'll see you today, we'll see you tomorrow, and you're going to get that average of 20 minutes every time you're in with us, eyeball to eyeball with your doctor. It's that simple.
You know, it's such a shame because when you said when you put up the slide and it said 20 minutes, that just seems unreal nowadays.
Yeah. My
You know,
physical was 7 minutes long last November. My physical.
Right.
That used to be an hour-long appointment, folks.
Yeah. So 20 minutes with the doctor is amazing. The last question here we're going to go through. It says, can you expand on the transportation benefit?
Sure. So the transportation is within that 5 to 10 mile radius of the centers. And not to sort of digress on this, but there are certain exceptions can be made if like someone's a couple miles outside of that range, but it's easy to get to them, like they're right off the highway, things of that, it's like one-on-one, you can talk to us about them if you're like, hey man, they really need this. What we'll do is if they're outside of that radius, we generally try to use the plan's benefits, the transportation benefits, and we'll arrange that for them. We'll even use their transportation benefits to help them get to their specialists and set those appointments with the transportation as well. But primarily it's that 10-mile radius with our vans. Most of our, 85% of our patients are actually coming from that radius. And it's logistically impossible to do this the right way and an affordable way to do it beyond that radius at this point. It could be down the road. Like I said, we're always sanding things down and trying to improve. It could be that we're willing to even invest in, we already have contracts with Lyft that if we needed to go outside of that range, we could start doing that. But right now we are growing tremendously in that 5 to 10 mile radius for these centers. It's easier to just say, okay, we're ready to open a new center that will be within the 10-mile radius for some of these folks that we're not in right now.
Right. Well, that's awesome that it's even an option and it's available. Well, Scott and Josh, thank you both so much for taking time out of your morning to really share this critical information with us. Before we do wrap up, is there anything that either of you would like to say in closing?
Well, one thing I just noticed, right now Scott's information is up on the slide. Brian, if you could just make sure that my information is distributed to the agents as well. I am going to be, as Scott mentioned, the primary contact for North Carolina. So, if anyone has some interest on this call, certainly love to hear from you. If you want to reach out to me, I'm happy to set up time for you one-on-one. If you're really interested in working with Oak Street Health, I can be your contact to find out, kind of where your book of business is or what health center is a good fit and connect you with some of our teams. And just kind of mentioning on the teams, I just want to throw in one more thing about our teams. We have great teams in every center, and Scott touched on it with the patient relations manager kind of being the insurance and referral expert, helping people get their plans and PCPs switch and mail order. But our teams and the work they do, the community room, which Scott mentioned, things like speed dating and things like that. We're continuing to do those efforts for our patients. We're dealing with a population that's not the most tech savvy and low income, but we're still finding ways to engage them. As Scott mentioned before, that the mortality rate is just a lot higher when isolation isn't involved. So just a couple of examples of things that we're doing right now, just kind of a COVID update is we still have things like a virtual walking group, for example, where our patients in the walking group will go out. If they have a smartphone, they'll text us a picture of where they went, if they went to a park, or we'll just call them and ask them, how far they walked and how it was, how they enjoyed it. We're doing things like a virtual movie screening where everybody will watch a movie and somebody from our team will reach out to the person after the movie and call them and just ask how they liked the movie, what they thought, just to get them kind of social interaction. So even though that we're not out there in the community, just like we and all you, you can't be because some of the distancing and the restrictions, we're still trying to be involved and make sure our patients know that we're still thinking of them, we're still checking on them, and just letting them know that they're still important to us, even though we can't see them in person.
Awesome. Awesome. And Scott, did you want to say anything, or you good?
I'm good. I just, I really appreciate Messer. Jeff Street was one of the first guys I met when we, you know, the 4 or 5 months before we were opening North Carolina. Just very gracious, very helpful in helping us get rolling and meeting folks. So I have a soft spot in my heart for Messer, and really would love to work with more of the agents on your side of the fence.
Awesome. Well, once again, Scott and Josh, thank you both so much for just going through that information. You know, as an agent, we should all see the benefit of that Oak Street Health is going to provide to our clients. And that is actually the number one thing that should be on our minds. We want to make sure that they're taken care of, and Oak Street Health is definitely going to do that. Once again, I want to thank everybody for taking time out of your day. Hopefully, you've learned some information that is going to help you in your business. And then also you'll translate that same thing over to your clients. If you're not contracted with Messer and you're on this call and you have questions about partnering with Messer Financial, please feel free to contact our marketing department at 866-568-9649 at extension 7819. Or you can email mfgmarketing@messerfinancial.com. And any questions that you do have, we will be more than happy to answer those questions for you. Also, take a moment to check our events calendar at messerfinancial.com. We actually have webinar workshops scheduled throughout the year with valuable information like you just received from Scott and Josh. Once again, I want to thank you all so much for joining us. Please be sure to take care of yourselves and everyone around you. All of you have a great day.
Thank you, everyone.
God bless.
Great to be a guest.